Hi, I'm Audrey, and today I'll be showing you how to do a routine venipuncture, also known as a blood draw. I'll be showing you the proper steps that you need to take to ensure a proper draw. The very first step is to perform hand hygiene. I'll be using hand sanitizer. Next, I'll gather all the supplies that I need. This includes gloves, a tourniquet, alcohol prep pads, sterile needles, collection tubes, gauze, and a bandage. Now I will identify my patient by asking them their name and date of birth. I'll compare this information with my lab requisition to make sure I have the correct patient. Hi, I'm Audrey. I'm going to be your phlebotomist today. Would you tell me your full name and your date of birth?
Sure, it's Mr. Dad, December 20th, 1970.
Perfect. I'll have you extend your arm out with your palm up. Perfect. After identifying the patient, I'll explain the procedure to them and ask them to extend their arm. Now I will apply a tourniquet 3 to 4 inches above the intended puncture site. I will then locate a vein by palpating the patient's arm. The most commonly used vein is the median cubital. Once I have identified a usable vein, I will clean the area with the alcohol or chloroprep. Now I will prepare the needle, connecting it to the hub. After my needle is secured, I anchor the vein by pulling the skin taut just below the puncture site. Now I will insert the needle bevel up into the vein at about a 15 to 30 degree angle. Once the needle is in the vein, I will attach the tubes into the hub and begin filling them. After my final tube is filled, I will release the tourniquet before removing the needle. I will then place gauze over the puncture site and carefully withdraw the needle before placing pressure on the insertion site. I will ask the patient to hold pressure with the gauze while I engage the safety on my needle and properly dispose of it in a sharps container. Then I will label the blood tubes. After labeling the tubes, I will check the patient for bleeding and apply a bandage. Finally, I will dispose of all my materials, remove my gloves, and practice hand hygiene once again. That's that. By demonstrating proper hand hygiene, patient interaction, and needle safety, I hope you now have a better understanding of routine venipuncture procedures.